Welcome back to Washington Watch. My name is Joseph Backholm, sitting in for Tony today. So glad to be with you and that you are with us. As we've already discussed on the program today, the major American airlines have dropped their mask requirements following a federal court ruling that overturned the Biden administration's mandate on masks for travel. Now, we just heard from a lawyer. We've discussed this from a legal standpoint. But what about the science and the public health? Joining me now is an expert in the field to discuss just that. Dr. Andrew Bostom is an academic clinical trialist, epidemiologist, and research physician at the Brown University Center for Primary Care and Prevention at Kent Memorial Hospital in Rhode Island. Dr. Bostom, welcome back to Washington Watch.
Thanks for having me back, Joseph.
We're glad to have you. Now, we just got done talking to Ken Klukowski, who kind of analyzed this from a legal perspective for us. He said essentially that the judge determined that the mask mandate from the federal government was arbitrary and capricious from a legal perspective. What's your reaction to that?
Oh, I am profoundly grateful to this very courageous judge for her decision. And she also did at least touch upon some of the science, because apparently there's an obscure statute that referred to sanitation. And she simply pointed out that, basically in layman's terms, that masks are, don't provide any form of sanitation. In fact, I would add, Joseph, masks that have been studied after clinical use, even short term in the operating room among surgeons, can really become heavily contaminated with bacteria. So she made a very logical scientific point, even though it's a little bit obscure. But the literature, the randomized controlled trials, where we really provide the gold standard evidence for whether an intervention in a masking is an intervention, works or not in its clinical application, are uniformly negative. For both influenza, and we have at least two large trials that have been reported for COVID. In other words, they tested the hypothesis that masking in the community would reduce community viral transmission. Again, there's been about a dozen studies for influenza in the community since 2008, and there's been two studies, including one enormous study for COVID. And all 14 studies consecutively from 2008 through 2021 have all been negative, and they've involved now, in aggregate, about 360,000 persons. So this is a lot of data, and it's strikingly consistent. And typically, Joseph, when the weight of evidence for clinical trials was, say, favorable, let's say not even all 14 had shown a benefit, say 12 out of 14 had shown a benefit, at that point, you would gather together the evidence, and there'd be some sort of consensus panel, and they would make a recommendation, Joseph, perhaps that masking could be applied in a situation like a pandemic, COVID pandemic, an influenza pandemic. But it would be a recommendation. Here, they've turned the whole paradigm on its head. You have all this uniformly negative randomized controlled trial evidence. And yet, the public health authorities have managed to push through mandates, or certainly recommended them, and then governmental authorities have pushed through mandates. It turns the whole evidence-based paradigm on its head, actually, Joseph.
Now, Dr. Bostom, there are different reactions to this judge's decision. And there are certainly people who are happy to be free of masks and the mask mandate. There are others who are concerned, who now express fear over traveling, being in close quarters on an airplane with people who are unmasked. What would you say to those people?
Well, I think the airlines have made a very compelling argument, and which is why they were urging that the mandate be lifted sooner, particularly when all these other mandates at the community level had already been lifted. And their argument is that certainly in the space that they can directly control, the airplane itself, there are now they've integrated some very highly efficient filtration systems that make the air constantly recirculated. And I think they've added sort of virucidal technology to kill virus. And that regardless of mask use, which again in the community didn't really work anyway, they're actually certainly in the cabins. People are in a very safe environment, So I think that's really all the argument that you would need to make to assure people. But again, I think there's been the idea that masks are somehow effective has been so heavily propagandized, and I have to call it propaganda at this point, Joseph, because again, the hard evidence is so uniformly negative that it's frightened people. It's frightened people unnecessarily. And again, the environment in a plane cabin is probably one of the safer environments.
It will be interesting to see the fallout of this, of course, and you alluded to this earlier, mask mandates have generally gone away previously in the rest of the country. Most people aren't wearing them in restaurants. Most people aren't wearing them in schools. Why is it, do you think, that airplanes and public transportation was one of the last areas for mask mandates to go away?
I think some of it is psychological. Well, I think part of it is a practical issue, a political issue. Is that the transportation systems, those kind of interstate mass transportation systems, are under federal control. So that becomes a political issue, as opposed to individual states having the right to limit, mask mandates in their individual communities. I think that people also, psychologically, it looks almost like a submarine, when you're in an airplane. And I think the closeness, ignoring the efficient filtration systems that are in there, puts a psychological burden on people that are fearful about transmission. So I think that may be, some sort of mitigating factor in considering why they've been kept on longer than the other forms of mandates.
Now, Dr. Bostom, in about 20 seconds, the White House is encouraging people to continue wearing masks. What do you say to that?
Well, it's consistent with their zealotry, but it's not consistent with the data and really with the desires, as you can see by the popular reaction of the vast swath of the population.
Dr. Andrew Bostom, thank you so much for your time today.
Take care, Joseph. Bye-bye.
The message there, I hope you heard, is you don't need to be afraid. And that's what we're preaching here all the time, is live fearlessly, whether there's a real risk or not. Now, there's a lot of things we don't control, and that's one of them. But stay tuned. Another issue to be concerned about, puberty blockers for kids, reversible or not. We'll talk about it.